Parkinson's disease psychosis is a major unmet need as far as the treatment is concerned. If you are to look at the prevalence of psychosis in general in Parkinson's disease, it is about 50%. In other words, 50% of the Parkinson's patients will develop psychosis sometime during their disease duration. If you are to look at a cross-sectional of patients with Parkinson's disease, the number might be closer to 30 to 40%, but depending upon how you look at it, it's between 30 and 50%. Currently, there's only one FDA-approved medication for Parkinson's disease psychosis. That is basically Nuplazid or pimavanserin. This drug was approved in the United States approximately 1 month ago, and it's the only approved medication we have for PD psychosis. Right now, when a patient with Parkinson's disease has psychosis, we use Nuplazid. The problem is that before that, we did not have any medications that we had to treat PD psychosis. We used to use other medications that are used for schizophrenia in patients with PD psychosis. The major problem with those medications is that it interacts on the dopamine system. So it actually has the risk of worsening Parkinson's symptoms. So other than clozapine and maybe quetiapine for PD psychosis, which would be off-label use, all other antipsychotic medications should be avoided in Parkinson's disease because it can actually worsen Parkinson's symptoms. We have a number of unmet needs in Parkinson's disease. One of the major ones is still Parkinson's disease dementia. Once a patient with Parkinson's starts having dementia, everything gets worse for them. The other one is balance difficulty and falls. Because there's nothing to prevent falls, that becomes a major risk factor on why some of the patients end up in a wheelchair because they cannot walk safely. Another one is freezing of gait. Patients trying to walk, suddenly their feet get stuck, they cannot move. Again, that's something we really don't have medications for. Parkinson's disease dyskinesias, there is no approved medications for dyskinesias related to Parkinson's disease. Today, our best option is reducing the Parkinson's medications, which results in worsening of the Parkinson's symptoms, or considering aggressive therapies such as deep brain stimulation. The other unmet need, I would say, is patients who have a lot of off time. Again, when patients have off time, we can increase their medications, which could result in having more dyskinesias, maybe having psychosis, but that's another one where if the off time is a major problem, we end up using surgical therapies such as deep brain stimulation. So basically, Parkinson's dementia, falls, freezing, dyskinesias, off periods, these are all still unmet needs when we talk about Parkinson's disease. Our biggest unmet need actually is curing the disease, or short of that, actually slowing the disease. And again, we don't have anything for either of those conditions.